Hey guys, welcome back. This is going to be part one of a four-part video series on Epstein-Barr virus. And today I want to talk about what Epstein-Barr virus is, how you get it, and what the symptoms are. So Epstein-Barr virus is a part of the herpes virus family, and it's just a very common virus. It's believed that up to 90% or more of the population actually has the virus. It's thought to be transmitted primarily by deep kissing, so that explains why a lot of college students get Epstein-Barr or mono. And there's usually a 6-week incubation period, so you can contract the virus and not really show symptoms until about 6 weeks. Now, there are a couple of signs and symptoms that are very distinctive with mono. So most people know about the extreme fatigue, and actually the fatigue is usually the last thing to go away once you're getting over the initial infection. But the other thing that's very distinct about Epstein-Barr virus is swollen cervical lymph nodes, and especially the lymph nodes behind the ear. Those are called the posterior auricular lymph nodes. So when those are swollen, that's one of the telltale signs that you're infected with an active Epstein-Barr infection. The other thing that's quite common is what we call facial edema, and edema just means swelling. So your face can look very puffy. The other thing is that the eyelids become very swollen, and that's rare for other conditions. Sometimes in kidney disease you'll see swelling around the eye, but specifically swelling of the eyelid is very distinct and very characteristic of mono. And so when a patient has eyelid swelling plus facial swelling, that is thought to be almost diagnostic in and of itself. So fatigue, swollen lymph nodes, swollen eyelids, those are the main things that will happen, especially a sore throat. I forgot to mention that. Practically 100% of patients with mono will have a very sore throat, and many of them will say that it's the worst sore throat they've ever had in their life. So those are some of the telltale signs of the initial infection. In the next video, I'm going to talk about what reactivated Epstein-Barr virus is and what are some of the consequences and reasons for having reactivated Epstein-Barr virus. And then I'm also later going to talk about how to test for it, because there are very specific antibody markers that can show whether you've had a past infection or whether you have an active infection, or if that infection from the past has been reactivated. So those are all patterns of markers in the blood that we can look at for antibodies. And then finally, in a later video, I'm going to talk about how we can treat Epstein-Barr virus. And that's going to be my favorite part, because in conventional medicine, there's not much that clinicians will do for mono. They'll tell you to go home and drink plenty of fluids and get rest. But when Epstein-Barr virus becomes reactivated, you're looking at something else. You're looking at asking, why is the immune system not able to keep that virus in check so that the virus actually was able to reemerge in the first place? And so as a naturopathic doctor, I'm looking at ways to support a person's immune system and looking at what botanicals I can use that have been shown in studies to prevent the virus from replicating and that upregulate our immune system, and also botanicals that can directly kill the virus. So that's my approach. I will talk about those issues in the next series of videos. Thank you so much for watching this video, and I will see you soon. If you like this video, be sure to give a thumbs up and subscribe, and I will see you next time. Bye, everyone.